is out after money and money only. No clue what happens. He has no clue what happens in the medical field. The medical field should be almost a three-tiered setup. We pay 1/3, government pays 1/3, and business pays 1/3. It is transferred from one job to another. There's no sweat, no strain. If you need to see a doctor, you need to see a doctor, but the rest of it should be done with highly qualified paramedics and nurse practitioners. And I've had very good luck with all of them. Thank you.
Thank you, Richard, and thank you for your service. And we're glad that you're with us. Sounds like you've been becoming a real recently. I want to be clear about what's being proposed, and I believe all of the proposals, not just HR 3200. There will be no change in your care at the VA. There will be no change in your care through TRICARE. There will be no change in TRICARE for life. That is not addressed. And if you have private insurance that you like and you have doctors that you like, you're going to keep them. So that's going to change. What this legislation is trying to do is trying to address the 50 million Americans right now that have it. The additional 20 million people that are underinsured. That's what this legislation is trying to do. Yes, sir.
You're very brave. George Vaughn from Town and Country. Is it true, according to a CBS report, that the IRS must divulge taxpayer identity information, including filing status, modified adjusted gross income, the number of dependents, and other information, as is prescribed by regulation, to the new Health Choice Commissioner and state health programs?
No, that's not true. Again, let me talk about how this bill is structured. And again, it's a work in progress. So the way that individuals will be able to buy into the system if they can't afford to, or through some affordability credits. And in order to ensure the person is not making enough money to be able to get this benefit, just like we do in other areas, there will be some coordination. But you don't have to divulge your children, your really personal information. Again, this is for folks that fall between that gap. And we think it's possible, if this bill is structured the right way, that most people will be able to come into the system pretty efficiently, maybe insuring about 97% of all Americans. That's the goal. Absolutely. You've got your 3 minutes.
Does that mean then that Section 431 is not appropriate?
We can pull up Section 431.
I would just like to add that my source of information is Dick Morris.
It permits this exchange program to receive some taxpayer information in order to assist the exchange in determining your eligibility. And again, that's going to be something that will be determined, but no, not all of your pertinent information is going to be divulged to them.
Well,
and again, if you choose not to participate and you don't want the affordability credits, you don't have to do anything. Again, this is
let me read some numbers and we'll have our next question. That way people can be moving down here while the conversation goes on. Next ticket, 4080. 6715. 6580. 8095. Okay, next question, or listener.
Sir, please.
Good evening, ladies and gentlemen. Many of you know me. My name is Marty Huffman. Many of you know me as a performer in this community. Many of you knew my family if you're a longtime resident here in Sierra Vista, if you knew anything about D&P hardware many years ago. I'm a retired firefighter. I'm married to a registered nurse. If the Congresswoman would indulge me for a minute, I'd like to tell you a little story. In 2001, my wife began having strange symptoms of numbness and tingling in her extremities, including fatigue and an episode of stroke-like symptoms. She was in her early 40s at the time. We saw doctors, including neurological specialists. As a standard practice in this country right now, we had an insurance involved in her treatment. The treatment she got was restrictive, and it contributed to the condition that we now deal with on a daily basis, which will ultimately end her life. What we now know is that if she had been correctly treated earlier, she might not be in the position she's in today. But because of the way and the insidious way in which insurance companies ration their health care to deny us service and out-of-network charges, we now have a paralyzed 48-year-old woman with limited communication options, confined